Thank you for staying. And well, I've got Nana Abna-Koko here with me, and we're going to be talking about mental health because she's a mental health advocate. I'm sure you all know her by now. She's a very beautiful girl, and she also is a teaching assistant of psychology, is it, at the University of Cape Coast. Great to have you. How are you doing?
I'm doing awesome.
All right, great to see you. So let's talk about all you've been through this year. If you were to review this year for yourself, what would you say it has been for you?
I'll say this year I've been a fighter, and whatever comes my way, if it's a stumbling block, I just step on it and move higher. So it's been a wonderful year. I'm ending it very, very well. And I'm ending it with this program at the Anchor for Psychiatric Institute, Xmas Sanity.
Xmas Sanity, I love the sound of that. So what are you going to be doing at the Anchor for Hospital?
Okay, so I have an NGO, Psychosocial Africa, and we've taken it upon ourselves that in our own small way we're going to promote mental health awareness, and we've done other programs in the previous years, and this year we are trying to take sections of the hospital that we can renovate in our own way, and also a way that we can maybe entertain the inmates, make them feel happy. I've been in a psychiatric institute before, and it's very, very depressing. And when you get out, you have to find out, how am I going to fit in? What does life hold for me? So for this program that we're going to have, it's basically we're going to have lunch with them, and we are going to launch the Xmas Sanity, something that we want to do every Christmas. So we're starting with Anchor for. We are going to donate food items, we're going to donate toiletries, we're going to donate cleaning supplies, and we're going to have lunch with them.
Really, everything that makes life comfortable.
Yes,
for them.
Because it's very depressing. Some of the inmates, they haven't seen their family in a very, very long time. When I was at the hospital, some people that I thought, okay, are my friends or are my people, you'd be expecting them to visit you, at least write to you something, but that alone, you being in there is depressive. The people that you rely on they don't show up. So
it's just interesting that the place you're supposed to be seeking help to get better actually maybe worsening your case, because the way you're saying is depressing. I'm just getting a certain sense that yes, I need help. I mean, this institution that's supposed to offer the help, but they cannot offer the help because they don't have what it takes. So beyond helping people who are in the Anchor for Hospital, for example, for psychiatric reasons, you're an advocate. I mean, this is a country, we have a lot of money. If you listen to the news and you hear how much people blow on you know, some really needless things, you say we have a lot of money.
Yeah, we do.
Apart from donating to people who have psychological issues, what else are you hoping to do?
For next year in March, we have World Bipolar Day, and for me, I've had a team of health professionals help me through my journey. I've used a psychiatrist, a psychologist, a psychopharmacist, a dietitian, and a personal trainer. Like, I go to the gym a lot so these are the core people that have helped me through my journey. And there are lots of people who ask me, how am I doing this? How am I going to help my mom? How am I going to help my sister? So by March, we want to have, let's say, this core team that when there's an emergency case, they'll be able to refer the patients to. Probably we'll just have an easy app that you have all these health professionals on.
That would be an interesting one to have an app. But you spoke about how you're going to help your mother and your sister. Are they also bipolar patients?
No. I'm saying people call me.
Okay.
There's a lady who did a donation yesterday. She was like, my mom was going through depression, and I'm so glad that you're talking about this mental health.
Quickly, I'm sorry, I wish we had a lot of time to do this, but quickly, let's talk about being a bipolar patient. Are there any risk factors, or I mean, it can just happen to anybody, or is there something that happened to you that caused you to become bipolar? It's basically
genetic, and then maybe your environment can cause you to develop it too. It's like diabetes. It's either congenital or your lifestyle or your environment can cause you to have it. So we don't have the diagnostic tools for me to know whether in Ghana here for me to know whether it's genetic or I got it from my environment.
But you can't tell. You were just diagnosed.
Yeah, I was diagnosed because I've been showing the symptoms for some time.
Which is just that people will know if they see someone maybe exhibiting the same behavior.
I think we have to leave that for another day.
Yeah, all right, that's okay. Wow, I wish I had a lot of time. I have a lot of questions to ask. But maybe we'll just leave it here.
I intentionally came for the short period
because
I'm running away from your questions.
You're running away from my questions. But is that list true? The list.
I don't know what you're talking about.
Oh, right, okay, that's okay. We don't know what you're talking about. Okay, so on that note, we'll just wrap it all up here. But I've been talking about mental health with Nana Abnakoko. She's doing great stuff, trying to help people like herself who may have a bipolar condition or other psychiatric or psychological needs. And she's going to the Anchor 4 Hospital to help people. People can help you, right? They can come to your Facebook page.
My Facebook page is Psychosocial Africa.
Okay.
And hotline you can call me at 0553 572710.
Okay, can you say that again? 0553
572710.
All right, if you missed that, just go onto our YouTube page. You can just go back and get the number again. She definitely will need your help and support. Let's show some love to people with psychiatric and psychological needs. But that'll be all for this conversation with her. We'll be bringing you entertainment news with Becky shortly. Thank you, dear, for coming.